Our next guest says the Republican health care bill is bad policy, and he was one of those who met with President Trump to talk about it yesterday. Heritage Action CEO Michael Needham is with us now. Well, you had the face-to-face meeting with I think you met face-to-face with the President yesterday. Is that correct, Michael?
Yep, we were over at the White House yesterday.
Was he amenable to any of your demands? Because I know you're not happy with the Ryan package. You've got your own. Well, was he amenable towards any of the changes you want to make?
I think that he showed a real openness to having conversation, to thinking about new ideas. There's going to need to be big changes to this bill. This bill keeps the fundamental infrastructure of Obamacare in place. It keeps the idea that the government from Washington, D.C. should have regulations that increase the cost of health care. It keeps the relationship between employment and tax and health insurance in place. And it also provides huge subsidies. So these are big changes that are needing to happen that are in order to make this bill acceptable.
But would you need
but the president was very open to new ideas.
But would you need all of the changes that you just laid out? Do you need absolutely all of them before conservatives can possibly vote for this? Or are you going to stand on principle and risk not getting any deal at all and upsetting the entire legislative process?
We understand how the legislative process happens. What we need to happen is the promise to repeal and replace Obamacare to happen. And that means taking the progressive architecture of Obamacare out and replacing it with free market reforms. And I think that if you're keeping that architecture in place and just changing some of the subsidies or changing a little bit around the architecture, that's never going to be acceptable. But if instead you say free market health care works, we should have patients and doctors be the ones who are making health care decisions, not government and insurance companies and your boss, then we'd be open to all sorts of creative ideas. But the key is to completely repeal the architecture of Obamacare. That's what the promise was, and that's what the president wants to deliver on.
And again, if you don't get that basic, if you don't get that, it's gone. You're not going to vote for it. You hold it up in the House, hold it up in the Senate.
Well, I mean, look, every conservative wants to get to yes, but if you're not repealing Obamacare, if you're not getting rid of the infrastructure of Obamacare, then why? How do people go home and sell that to their voters?
The taxes go away, the mandates go away, the Medicaid is to some degree reformed. I mean, that's not enough.
That's just not true. So the individual mandate goes away, but now there's a 30% tax if you don't have continuous coverage. The infrastructure in terms of the regulations, the essential health benefits. The essential health benefits package, the health status rating, all of this stuff remains in the bill. The idea around Obamacare was that bureaucrats in Washington, D.C. would set regulations on what is health insurance, and that they would then provide subsidies to help people buy that insurance because it's more expensive. What does Paul Ryan's plan do? It continues to have regulations. Title I of Obamacare, much of it stays in place, and then it provides a new form of tax subsidy. That's Obamacare in a different way. And so we need to take away that fundamental infrastructure, replace it with free market reforms, and we can do that in different ways, and we can have that debate. But if you're buying into this fundamental premise that it's the federal government, your insurance company, and your boss who are making your health care decisions, that's a progressive health care system that needs to be repealed.
Well, you know where I'm coming from. I don't hide my light under a bushel. I want a deal. I want a deal so you can get on with cutting taxes and you can get on with growing the U.S. economy. I want a deal.
We all want that. We all want to get to yes, but it's important that when you get to yes, you're actually not just claiming that you're repealing Obamacare, you actually are repealing Obamacare.
Well, the standoff continues, doesn't it? But, Michael, look, we really appreciate you being with us. You're the intellectual force that's driving this thing on from the right, and we appreciate you being here today. Thank you, Michael.
Appreciate the time.
Okay, sir.